Hi, I'm Dr. Castro. How can I help you today?
My throat's been hurting really bad. And when I looked in the mirror, there was white spots on the left side.
Have you experienced any vomiting or fever?
I haven't thrown up, but I had a fever of 101 degrees.
It doesn't seem like you have a common cold, so I'll test you for strep.
Okay.
Hello, I'm your nurse for today. I'm gonna just swivel this around in your throat to test you for strep. Okay.
So your test results say that you don't have strep, so I'm going to try testing you for mono.
Okay.
Alright, I'm just gonna prick your finger because for this test, unfortunately, we can't just swab your throat.
So the test for mono came back positive, and unfortunately there isn't any medicine we can prescribe. It's just one of those things you have to kind of wait out. And normally mono lasts 2 to 6 weeks, so just make sure you get a lot of rest, stay hydrated, and also stay away from contact sports, because if you get hit in the right area, you'll hurt your spleen and it'll swell up, and then you have to come back to the doctor or the hospital.
Okay.
So just wait it out. I forgot to give you these earlier, but here are some flyers to help you.
Okay.
Have a nice day.
I'm sorry to bother you, but I'm really interested in your career. Would you mind telling me about it and the steps you took to get it?
Yeah, it's no problem. Well, the steps to becoming a doctor are long and hard. I knew since I was a child that my purpose was to help people, especially when it came to their health, because I always used to help my grandmother with her medical issues. Then my freshman year of college, I took a class that really helped me with what I thought my purpose was, and then helped me plan how to get where I am today.
That's pretty cool. How did the classes help you?
It mostly helped me when I took an assessment to figure out what my strengths are. With the assessment, I learned how I could use my strengths to help me reach my career and how they would help me in my career.
What were some of those strengths?
Some of them were considerate, positivity, and harmony.
Oh, I see how those could be useful. What steps did you take to become a doctor?
Well, first I had to pick a major in college. I picked biomedical sciences because all of the science classes would help me later on. Then I graduated from college with a bachelor's degree. However, my senior year I had to take the MCAT, then decide what kind of medical school I wanted to attend. During my junior year I started applying to medical schools. My first 2 years I learned the fundamentals of medical science. My third year I worked for 1 to 2 months in each major specialty, and my fourth year I took electives based on my preferred specialty. And after all of this was done, I took my board exams. And after my exams, I started my residency and then fellowship.
Wow, that's a lot of time in school and a lot of work.
It is, and it's a lot of work too. But whenever I felt overwhelmed, I thought about a doctor I interviewed in college who didn't choose to become a doctor until years after he graduated from college.
I actually had a little bit of a unconventional way of getting here, because I started and I did my undergraduate work, and then I went to graduate school, and then I decided after I had been working and making some money and starting a life that I wanted to do medical school, and so it took me a little bit longer.
But you can also go on the website for Association of American Medical Colleges to see how to become a doctor and to decide if a career in medicine is right for you.
Also, what are some of the basic skills needed when you're a doctor?
One important skill needed is communication, because it's important to be able to understand what a patient says and to be able to explain things clearly to them. They also need interpersonal skills because they must work in a team. Doctors don't just work by themselves, they also work with nurses, lab technicians, and other physicians or pharmacists. Doctors must also be able to pay attention to detail, especially when it comes to a patient explaining symptoms and recording information on patients. Reasoning skills are also necessary to evaluate problems such as making a diagnosis.
I have one last question. What do doctors do on a daily basis?
They monitor and provide general care, make investigations on patients with special care, and provide treatments. They also examine and talk to patients to diagnose their medical conditions, take notes on them, prepare paperwork, and work as part of a team, either within their own department or other specialties.
Okay. Thank you so much for telling me the necessary skills to be a doctor and what it takes to become one.